Growing up in Florissant, Missouri, right down the street was Sunset Park. But today I'm in a different Sunset Park. We are in Brooklyn and we are here with Dr. Rincon. Nice to meet you. How are you today?
I'm good, thank you.
So Rudy, you grew up kind of in this whole area.
Yes.
All right.
Yes.
So what is your favorite thing about this part of Brooklyn?
One of my favorite things was definitely the sandwiches.
Okay, the sandwiches
and
the pizzas. Sandwiches and pizzas.
Yeah.
I heard they're pretty good myself, and maybe we'll have a little treat afterwards.
Sure.
But today we're in front of your big, beautiful, wonderful dental office.
Yes.
How long have you been here at this location?
Well, this all started with my dad. He was here practicing for 30 years, and I just recently took over. He retired due to health issues, and I've been here going almost on 2 years.
Amazing, amazing. Now your journey is kind of inspiring. Do you mind if we talk a little bit about it?
Sure.
Okay.
Sure.
So originally, growing up, you went to college and you weren't really sure you wanted to be a dentist, right?
Well, no, I did. The only thing is, unfortunately, got into college a little bit distracted
Okay.
in terms of, other than my studies. That's what happened.
Understood.
Yeah.
So you wanted to be a dentist, but then that pathway might not have been available to you.
At that moment, yeah, there was a little bit more obstacles.
But you decided to go for it anyway.
Yes.
Congratulations.
Thank you.
Because I realize that everybody's journey, sometimes we start out one place, right? We know where we want to go, and sometimes we get a little distracted, then we get back on track. But now here you are, you had the wonderful, I guess I would say, tutelage of being able to, grow up with your dad, like him always being a dentist.
Right.
What are some of the top things that you feel like you learned from him, from your dad?
Wow. I mean, if there's ever somebody that I would consider my hero, my role model, it was him. Just how he approached life, how he would treat his patients, how he always told me to just, whatever I do, just be the best at it. And all the advice that he ever gave me, I didn't always take it for stubbornness, but now growing up and being older and seeing it, it was the best advice I could have gotten. So I'm very grateful that I had a really, really strong, I still have a very strong relationship with my dad, even though his health issues, but I still keep in touch with him and we still communicate. And
I'm sure he's very proud of you.
Yes.
Yeah,
Yeah.
Extremely proud of you. And also your mom.
Yes.
You grew up with two wonderful parents.
Yes, absolutely. My mom was very strict, hard,
Okay.
but she was also another one that said that, I have everything to make something of myself, to be what I want to be. And there were a lot of times where I've noticed the frustration on her face, but she always stuck behind me 100%.
So you're doing really well here now. You've got a beautiful, wonderful practice. What is it about being a dentist here in this particular neighborhood that just fills you with joy?
This neighborhood has always been underserved.
Okay.
It's one of the few, or one of the many in Brooklyn, where patients come in. Unfortunately, they go to certain institutions, but it takes a very long time for treatment. Either get an appointment, or they don't feel that they're being attended to the way they would like.
Got it.
So a lot of them come here, and because I'm bilingual, this is mainly a Latino neighborhood. They feel very comfortable with me because they feel that I can relate to them, I can speak with them, explain to them well, and they don't have to wait so long either. So.
And how would you say that? How would you say exactly what you just shared with me, but say it in the other language?
In the other language.
Sí.
Bueno, tienen mucha confianza conmigo. La comunidad de aquí de Sunset Park, la mayoría es latina, y desafortunadamente cuando van a instituciones a veces no sienten esa atención que merecen. Entonces vienen conmigo, les explico lo que necesitan y se sienten cómodos y confían en mí. They trust me. Yeah.
Gracias. Thank you for sharing that in the other language,
Sure.
because we want to have that ability to communicate and to reach the people that you want
Right.
to help so much, right? No matter what language they speak.
Right, of course.
But I think that's wonderful that your practice is a safe space,
Yes.
and respects the people that come
Yes.
here. what is it about our teeth, right, that make what we eat somehow related to that? Is it true that like good dental hygiene or what we eat can affect our mouth?
Yes, absolutely. I'm very much of the opinion of prevention before the problem starts, because once the problem starts, I mean, we have to find a solution. We have a lot of advantage in that sense, because now the patient can be more informed as to what they have to do to prevent any sort of decay or gum disease or whatever the problem would be. Yeah.
Sometimes people sadly do lose their teeth, but you have the ability to have a wonderful lab here. You're able to diagnose when somebody needs an implant, correct?
Yes, we specialize in what's called mini implants.
Okay.
It's a different type of system as compared to the conventional ones, but it's been in the market for a very long time with very great results, great success, a lot of literature on it. And when I took the course to learn about it, I was skeptical myself, but once I started hearing and seeing and looking at the results, I was fascinated by it. So I even purchased myself what's called a CBCT scan. Which CBCT.
Okay, CBCT.
Yeah.
Got it, okay.
Right. So it's a 3D scan. It gives us a 3D scan of our in this case would be our jaw and the bone that we have and how different structures of the mouth, so that we're able to place an implant without affecting any vital structures.
Lovely.
And that it could have long-term success.
Now, what's the turnaround time from the time that somebody comes here and you realize that, hey, you know what, I'm really feeling like you need an implant, to the time that that they can place that temporary or that actual tooth in?
I mean, it's very small.
Okay.
Fortunately, with many implants, it's a lot less invasive than the conventional implants.
Great.
So it can be placed in one setting. I don't have to refer, like normally sometimes I would have to with a specialist.
Right.
We can do this in the office here, and so far the results I've had, patients have been satisfied. And that's
well, that's
great.
important.
That's
right?
great.
That's
yeah.
important.
That's great.
Well, I know that you really care about your patients. You also have a wonderful team here.
Yes.
Someone that's been here like over a decade.
Yes.
And I think that comfortability and that likability and that faith in each other
Yes.
makes a huge difference.
Yes, she started off working with my dad as well, and she's been someone of great confidence for the past over 10 years. And right now, I trust her to help me run this office. I mean, basically with my life, because she knows the ins and outs, and also the patients trust her. The patients know her, and they've gotten to really feel comfortable with her, and that's not always easy to find.
Yeah, you know what? It takes a lot when you walk in, because sometimes people are nervous.
Right.
And being able to put them at ease makes all the difference.
Yes.
And if you don't mind, could you also say that in Spanish for me? Just about the comfortability. Like it feels like a home here.
Yeah.
Okay.
Bueno, aquí en la oficina tratamos de que el paciente se sienta cómodo para que estén en confianza, estén en su casa. Tenemos un equipo, mi asistente de muchos años, ella también. La gente la ha llegado a conocer y se sienten muy bien con ella. Ella puede hablar con ellos, explicarles bien también, y afortunadamente hemos tenido buenos resultados por lo mismo.
I speak very little Spanish, un poquito, but I try. But I did understand what you said.
Okay.
I thank you for inviting us here today. What's one thing that you want to make sure that the audience knows?
Yeah, I had a patient the other day. She came in very nervous, very scared. It looks like she was traumatized as a little girl, and it's it's a challenge sometimes, because you want to try to comfort the patient, but you understand their trauma. You understand.
Yes.
So I try to talk to them. I try to explain to them. Sometimes I'm successful. Other times, unfortunately, the trauma is too deep that I go, you know what? I don't want to keep traumatizing you. Let's see what else we can do, and we'll go from there.
Well, thank you very much. Had a really great experience here today getting to know you. Congratulations on the beautiful practice that you built.
Thank you.
I really respect you for what you've gone through,
Thank you.
and I know that you can motivate people to have the best lives, especially with a great smile, right?
Yes.
It builds confidence for
Yes,
people.
definitely.
And you have a great smile.
Thank
So,
you.
you're welcome.
So do you.
As you should, right?
Yes.
Growing up the son of a dentist.
Yes.
Well, I'm Donna Drake. We've been right here at Sunset Park with Dr. Rincon. He's a great dentist. Stay tuned. We're living it up right here in Brooklyn.